Hi, my name is Justin Yancey, and I'm a neurologist here at SIMEDHealth. So memory is the main issue with Alzheimer's disease. Oftentimes people and families will notice that patients often forget, certain dates. They may forget certain events. They may forget to go to their doctor's appointments. They may be repeating some of the same stories or asking some of the same questions. Often they need to rely on their memory aids. People often will start leaving more sticky notes. They'll often start writing down reminders for themselves around the house. They may have more challenges doing kind of common household things. A lot of times people who cook may forget certain recipes, have a hard time following those recipes. They maybe forget some issues like paying bills or having trouble managing their checkbook. They may sometimes get lost driving to certain locations or taking the wrong turn. They often make multiple lists for going to the grocery store. They may have some trouble in conversation, some word finding difficulty, and then they'll often misplace objects multiple times, some their keys or their cell phone, and it seems to be more obvious. So Alzheimer's disease seems to be very complex. It seems to be a combination of environmental and genetic kind of lifestyle changes. Age seems to be the biggest risk factor for Alzheimer's disease. The risk doubles about every 5 years after age 65, and by the time people are age 85, about 1 in 3 people probably have Alzheimer's disease. There seems to be some small increased risk if you have other family members with Alzheimer's disease, but fairly small. Most of the risk factors you can help with are things like high blood pressure, diabetes, smoking. Patients who've had strokes in the past and history of head injury may be increased risk for having Alzheimer's disease. So there are things you can do to try to help prevent Alzheimer's. The biggest thing is maintaining a healthy lifestyle. So physical activity, mental activity, making sure you're getting good sleep at night. You want to control those risk factors we discussed, like high blood pressure, diabetes. If you're a smoker, you should quit, and avoid any heavy alcohol use. There seems to be some studies that say maybe the Mediterranean diet is helpful. Those are high in fruits, vegetables, whole grains, healthy fats. And then make sure you're maintaining social interaction with your friends and family and keeping up in conversations with them. So Alzheimer's disease, there is currently no cure, but there are things you can do to help. So for family members, they want to make sure that future planning for things like finances, legal decisions, and long-term care, as the disease gets worse, memory will continue to get worse and they may need long-term assistance. Family members also have to discuss about driving. Driving may end up being an issue and no longer be safe for the patient or others. They also want to monitor for any safety around the home, make sure that the stove's not on, people aren't leaving the water running, that they're not going out in the middle of the night wandering off. And they also want to make sure that daily care needs are met, such as eating, bathing, and dressing. So if you or a loved one is concerned about your memory, speak to your primary care doctor, get in to see a neurologist. There is testing we can do and there are medications that can help.